Today is our brief introduction to public health nursing. So we've talked about the foundations and the essential services of public health. And now I want you to pay attention to what this means specifically for nurses. So we'll start by going all the way back to the US Constitution. So way back, hundreds of years ago in our Constitution, it was actually written that we, the people of the United States, are to establish justice, ensure domestic tranquility, provide for the common defense, and here we go, the big one, promote the general welfare. So it is in our Constitution that we are charged with promoting the general welfare of every individual in our country. And then our state, California, has gone further to actually identify public health nursing as the only nursing specialty and certification straight out of getting a bachelor's degree in nursing. They recognize that public health nursing is a service of crucial importance for the health, safety, and sanitation of the population in all of California's communities, again, now more than ever. So these services include, but are not limited to, control and prevention of communicable disease, promotion of maternal, child, and adolescent health, prevention of abuse and neglect of children, elders, and spouses, and then a variety of things related to the community, such as outreach, screening, case management, coordination, assessment, and delivery of care. So these are all things that we will discuss in our class. We'll soon be talking about communicable diseases and epidemiology. We will talk specifically about issues related to maternal and child health, and we will talk about abuse and neglect, and then all the different things that go into referring to services and assessing care and promoting health in our communities. The American Public Health Association, I mentioned before, is our premier national level public health organization, and they have said specifically that public health nursing is the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. What I love about this definition, this really resonates with me, is that public health nursing goes beyond just what we've learned specifically to nursing, but that we are incorporating social science, public health science, and just taking in, not only is our practice broad and incorporates a wide variety of collaboration with other specialists, but we ourselves are to be informed by a variety of disciplines as well. So we cannot go much further without talking about the dear founder of public health nursing, Lillian Wald. Instead of talking about her here, I have two links of quick articles that I want you to read. These are also listed in Canvas for you, where you get to really find out about what an incredible woman she was at a very young age, in her early 20s, straight out of getting her nursing degree. Her and another friend and colleague started what has now become, over 100 years later, an incredible service in New York City in serving those who are often underserved, uninsured, and have a lot of extra health-related needs. And she just was very countercultural in her day and age and fought to serve those that no one else was willing to serve, or that people were saying that they deserved to be poor and sick. And she really flipped that on its head and created an incredible community organization that is still thriving today, and that meets health needs, not just physically, but mentally, socially, and spiritually as well. And then this is the video I've linked in Canvas as well, where you can watch what the Henry Street Settlement, the organization that she started, what it looks like today, 120 plus years later. And you can watch all of that in 4 minutes. It's so powerful, and I almost cry every time. Other milestones, I won't read these for you here, but I do want you to know about Mary Breckenridge, who started the Frontier Nursing Service. It is so important to know our heritage in public health nursing and to know about these nurses who really decided to take their wealth and their education and do something really valuable with it, and just really reach those who were underserved in their day and age. This is what makes up our foundations. She started a horse riding service in the Appalachian Mountains, And then there's a little bit more here that I want you to know about Lino Rogers, who was our first school nurse, and was actually a Henry Street Settlement resident. And then also about African American public health nurses, specifically Bessie Haas, who again went against the grain, advocated for themselves and for the populations that they served, had a lot of barriers. So hospital nursing is what we're used to learning about, especially in your undergrad nursing degree. And we tend to think of hospital nursing based on the setting of the hospital, and then maybe the location of your actual unit and the specialty that you have. So you might find yourself in one of these specialties listed here currently. But community health or public health nursing looks at more big picture. So we're looking not so much at as the setting, but more as at the population or the community that you serve. Acute care nursing or hospital care nursing tends to focus on what we call tertiary prevention. We'll talk about the levels of prevention in public health in the next week or two. But mainly, acute care is dealing with the problem after it already exists and usually looking at it on an individual level, whereas public health nursing is more focused on primary and secondary prevention. We're looking at health promotion, and we're looking at screening, and we're looking at preventing problems before they exist. And we're looking at how can we do that on a population or systems-based level. I have linked this handout for you in Canvas, but I think it's really powerful. So it's similar to what we talked about in our previous lecture, where we talked about the American Public Health Association's 10 essential services, and now we are going beyond that to apply that specifically to nurses. So this is also 10 ways or services that public health nurses improve health. They're not the same as the essential services from the wheel, but they are very similar. There's a lot of overlap, and this might provide a little more context for nurses specifically. So I want you to be familiar with these and to understand what they mean, and to be able to identify for our discussion board, are you using some of these services now, even if you don't consider yourself a public health nurse? Because my guess is that acute care nurses do many, if not all, of these things in their professions and specialties as well. I'd like to end with this quote from our dear founder, Lillian Wald, who said, "Nursing is love in action, and there is no finer manifestation of it than the care of the poor and disabled in their own homes." This speaks to home visiting that still occurs with nurses today. I have a video linked for you on Canvas that shows the Nurse Family Partnership. This is a national evidence-based program, very successful. We have a branch of that in the county of San Diego, where nurses develop long-term relationships with new moms and babies and toddlers to provide for their health, not just physically, but mentally, emotionally, socially, spiritually, economically as well. So home visiting is still alive and well. It's a very evidence-based practice in public health nursing. And also, I just love that this quote identifies that public health nurses are all about reaching people where they're at. I think that's a foundational principle in public health.